Hello everyone. My name is Melissa Knupp and I am a registered nurse. I have worked as a radiation oncology nurse for 17 years. Recently I've taken part in a collegiate debate regarding the North Carolina House Bill 655, Health Care for the Working Families. This bill seeks to provide health care coverage for uninsured working residents of North Carolina, and to establish the North Carolina Rural Access to Health Care Grant Program. Nothing in life is free. This bill states that the federal government would cover 90% of the cost, while the hospital and health care providers contribute 10%. The North Carolina House Bill 655 was introduced in April of 2019 and has completed its first revision. I am in favor of this legislation for several reasons. With all the changes in health care, there are still hundreds of thousands of working citizens who do not have insurance. They either are not employed full-time or are not making enough money to afford health insurance. Often these individuals cannot afford preventative care and do not seek care until they are very sick. As a nurse in a rural community, I have often cared for patients with out-of-control hypertension, diabetes, anxiety, which leads to stroke, kidney and heart disease, and depression. These patients chose to buy food and pay for utilities for their family instead of paying for a checkup out of their pocket. A sudden ER visit is very costly to the family or to the hospital when the patients cannot pay, and all of this could have been prevented. Next, House Bill 655 is designed that funding would come from local, state, federal, and from the participants. All participants would pay an annual premium, billed monthly, at a 2% of the participants' household income. Third, this bill would create the North Carolina Rural Access to Health Care Grant. Many of our rural areas lack health care that larger cities have. House Bill 655 would provide funding for these rural health providers, recruitment, retention, and incentive program. Telehealth has potential to reduce healthcare costs, particularly in rural America. The grant would be used to modernize of health information technological systems and expand the telehealth program in these areas. This grant would look at ways to address and combat the abuse of opioids by citizens in these rural areas, infant mortality, and expanding mental health services to these areas, which are greatly needed. House Bill 655 would have a positive impact for patients and nursing professionals, increasing the number of primary care doctors, reducing wait time to get an appointment, opening health and wellness centers closer to home, and increasing mental health professionals in areas where there presently are none. All these activities would reduce or eliminate health disparity in the rural North Carolina. Now, this bill is not perfect, and there are questions regarding the 2% that the participants must pay, and that it could be too high. I believe this area of the bill could be reduced to safeguard active participation. The North Carolina House Bill 655 would be beneficial for health care for the working families who otherwise cannot obtain health care coverage. Please join me in supporting the North Carolina House Bill 655. Thank you.